How many of you have been diagnosed with a thyroid problem? Okay. For the two of you, do you currently take medication?
Yes.
Okay. Have you been on medication for more than a year or two?
Yes.
Okay. If I can ask you, what brings you in?
I'm even with the medication, it's not under control.
Sure, absolutely. Okay. How about yourself?
Same.
Sure. Are they always changing the meds? Are you seeing kind of that I call it a hormone roller coaster where they're always fluctuating? They can never get your TSH levels right? Sure. Okay. For the two of you who are not diagnosed, what brings you here tonight?
Some of the symptoms I was providing.
Okay.
Not so much palpitation, but tachycardia and memory.
Okay.
Allergies.
Sure. Have you been checked by your doctor, and have they said nothing's there, everything looks good, or have you not had that next step down yet?
It hasn't been that bad until recently.
Okay. Sure.
All my hair loss is thinning.
Okay. All right, definitely. Okay. All right. Well, what we're going to do, one more time, my name is Dr. Akiba Green. We are here talking tonight about how to help you guys with your chronic health problems. Everything that we do is a non-drug treatment to your conditions. And again, if we talk about how am I going to help you with thyroid problems, and for some people it's thyroid, for some people we see here it's infertility, we see patients who have irritable bowel problems, we see people who have neuropathy, which is burning in the feet, brain fog, menopausal symptoms, a lot of different chronic problems people come in for. And what we're going to talk about is how can we address your symptoms? How can I give you a better chance at improving your life? Good evening.
Hi there. Sorry to...
No, you're good. We're just getting started. I want to start by giving you guys a little background on myself. My name is Dr. Akiba Green. I am a chiropractic physician. I love talking about this because when you came in here, right over the door it says chiropractor. You're saying, why am I going to a chiropractor's office to talk about thyroid? The reality is it's not such a stretch. And again, Johnny knows, he's been with me a long time as a chiropractic patient, but chiropractors are great when it comes to back and neck and headaches. That's only a small piece of what we do. And the core tenets of chiropractic are based on a whole health approach towards improving your body naturally, without drugs, without surgery. More specifically, I am trained in a couple key areas. I am board certified in integrative medicine. I am board eligible as a clinical nutritionist. I've completed a 300-hour postgraduate program. I sit for my diplomate exam in the spring. I am also enrolled in two other very important fields of study. One is with the Carrick Institute of Postgraduate Chiropractic Neurology, and it is a program that will terminate probably about 700 hours worth of training in a diplomate to become a chiropractic neurologist. The last field of study is through an AMA-backed functional medicine group called A4M, the Association for the Advancement of Anti-Aging Medicine. All those clinics that you see out there that do like Amorbi, the pellets, the hormone treatments, the testosterone shots, everything that you see, the anti-aging medical doctors that are out there, it's the same organization that does all those training. They have another field of study, though, that is a little bit more important to somebody, and it's actually called Integrative Cancer Treatment Fellowship. And I'm involved and enrolled in that program. And really, the key thing is I'm here to learn as much as I can so I can help you with your health problems. This year alone, I've gone through 284 hours of continuing education, and I have one more seminar in December that I'm doing. So we're talking almost 300 hours this year. My board requires 24. So I definitely go above and beyond it. And my family bears with me because I'm here to help you guys, and by learning, I'm able to do that. I do want to mention two doctors specifically that I've trained under that really relate to thyroid problems and autoimmune problems. The first doctor is Dr. Datis Karazian. He is a world-renowned thyroid expert. He has a private practice in San Diego, and he also is a huge researcher and the author of a really, really amazing book that all my patients have for required reading. It's called Why Do I Still Have Thyroid Symptoms When All My Lab Tests Are Normal? And it's, again, we've talked about what you guys see every day living with this condition. The approach that Dr. Karazian put together really makes sense, and it helps us address the underlying causes of your dysfunction. The other doctor that I've trained with is Dr. Michael Johnson. He is a chiropractic neurologist and an autoimmune expert with particular emphasis in MS and other autoimmune diseases. He has a practice in Appleton, Wisconsin, and he's a doctor that I work with very closely. With that being said, everything we do is to practice functional medicine, functional neurology, And again, as we get into the integrative cancer therapy for certain patients as well, just how do we help our patients from a different perspective. Now, I have 3 things I want you guys to know today. Really, these are goals of mine. For tonight's lecture, most importantly, goal number 1, I am here to reinvent your life. And this is huge because every single one of you came in because you have a health problem. You're dealing with these symptoms and you're not getting the results that you're looking for. Or you don't know where to turn. And you're living with it. You think you're stuck. I'm here for you guys to get an exit strategy. I want to give you an opportunity to kind of step off that train, take that exit, and get a new life. And I'm going to show you over the next 45 minutes how we can accomplish that. Now, we are going to talk about the thyroid specifically. As we address the thyroid gland, does anybody here not know where a thyroid is? So we're talking basically either side of the throat. We're going to go right in this lower bone right here. We're going to go on either side of it, and you can go up to where your jaw is and then go down just a little bit. You've got 2 sides of the thyroid. And the key thing is if we talk about that gland, it controls so much. It's a small little gland, but it regulates everything in the body. I'm going to go over some common symptoms that people see with thyroid dysfunction. Now, a lot of these symptoms are hypothyroid, but they're not only. Some of them are actually hyper as well. And Matt, do me a favor, if you will, because I know you can't. No, you're okay. I was going to say, if you want to do page 4, okay, go ahead, but don't bother with the rest of it, because I'm going to walk you through it all.
I have to leave soon, so I was sorry. But anyway, I'll go to page 4.
I was going to say, if you want to fill stuff out, start on that, or just listen to me if you want as well, and you'll pick it up as we go, because it's interactive,
and
okay?
I have all your websites.
Absolutely. All right, so if I talk about thyroid symptoms, what I'm dealing with is really the most common symptom we see is fatigue. That is the single biggest thing that thyroid sufferers deal with. They're tired. No matter what happens, it's there. We talk about weight gain, even on a low-calorie diet. No matter what you do, I've got patients that literally will go through boot camp. They do they do CrossFit. They do everything you can imagine, 7 days a week, and they're still the same weight they were when they started. I mean, they don't lose a pound. And all their friends, of course, are losing the weight left and right, and they don't understand why it's not helping for them. We talk about morning headaches. They tend to wear off as the day goes on, but they're always there. We talk about depression. Neurological symptoms are huge with thyroid problems. I don't talk about it on these slides, but a huge thing that we talk about with our patients is something that I call brain fog. We talk about concentration problems, memory problems. So we'll get into that a little bit. But really anything, depression, anxiety, irritability, these symptoms are classic for neurological dysfunction. Constipation. And we talk about gastrointestinal problems. And again, we talk about the bowel. The thyroid plays a huge role with our bowel. Stomach aches, gas, bloating. Again, all of these GI problems really associate with thyroid problems. Cold weather sensitivity. How about poor circulation? Again, that cold hands and feet, especially this time of the year. But it could be here. It could be in the summer. Your hands are freezing. In the winter, your hands are still freezing. It doesn't matter. You're always not getting the circulation that you need into your extremities. How about muscle cramping? Even while resting, we're going to see that restless leg cramp up. No matter what you do, it's why do my muscles always hurt? You get sick easily, and when you're sick, you're out for weeks. But I'm going to tell you, there's another kind of thyroid patient. It's a patient who's never sick. They're patients who their whole family gets sick, and they're so strong they never get that cold. It's not always a good thing though. Because what can happen is your immune system may fight off that common cold, but it may be strong enough that it's actually attacking your thyroid itself. And we'll talk about that. How about your slow healer, circulatory problems? How about no matter what you do, no matter how much sleep you get, you're still tired, still exhausted. Patients that come in, they get 6 hours of sleep, they're exhausted. 8 hours of sleep, they're exhausted. 12 hours of sleep, they can go right back to bed. Itchy, dry skin, dry, brittle hair, especially the lateral 1/3 of the eyebrow. Now, I covered a lot of different areas here, a lot of different parts of your body. And if we talk about the truth, your thyroid has an involvement, has a function with almost every cell in your body. And the thyroid produces hormones that have receptors everywhere. So, when they told a few of you that you had a thyroid problem, they didn't really tell you how big it was that you had that thyroid problem. And it really does impact almost every part of your health. How many of you are sick and tired of going to the doctor to have them tell you there's nothing wrong? Sure, that's why you're here. And the reality is, the doctors that you guys are currently seeing don't know what they're doing. They don't. And all we have to do is look at 2 of you in here and see that you've had this condition for at least 5 years to know that. For those of you that were recently diagnosed or think you may have a problem, if they knew what they were doing, then we wouldn't have people dealing with this 5 years down the road. And that's the real key thing. We know that they don't know where to go. They don't know how to address these health problems. A large part of the reason for that has to do with what is allowed for doctors to train with. And what happens is, and we talk about the endocrinologist with thyroid, but it's not just the endocrinologist, it's all of our doctors. The overwhelming majority of physicians don't read medical journals. They literally don't have time in an insurance-mandated office. They have to get from room to room to room, and they don't have time to read insurance. So it's 300 hours of continuing education that I've gone through this year. They have to do 30. And the 30 they do are at a golf resort with their family in Miami. And we know that. They're not learning. The vast majority of them are not. They rely on what they learned in school 15, 20, 30 years ago. And quite simply, it's outdated information. If I take my textbooks, and again, my textbooks are, I went to chiropractic school going on 15 years ago at this point, and those textbooks are probably 20 to 25 years old. The information in those textbooks is closer to 40 years old. We're talking, literally, there's so much stuff that has changed. What I was taught in school is not how we even know stuff exists. It's that different today. And if you're out in practice, and you've been in practice for 30 years, you're not going back and relearning anything. You're doing what you know to do, which is not what you guys need. Like I said, they don't know what they're doing, and they never will. And I'm going to tell you why. You guys are going to actually write something down for me. All right, I want you guys to go to page 1. You've got my mission statement on that. You're going to write this down. You are all suffering from a web of physiological dysfunction. None of you in here, none of you have just one problem. Physiologically, it's an impossibility. What I mean by web of physiological dysfunction is you don't have just one thing wrong. You've got multiple things wrong with you. And again, we talk about everything from cell problems, cellular issues. You talk about, DNA damage, oxidative stress, fatigue, fatty acid metabolism. You've got liver problems, immune problems, brain problems, mind-body issues, adrenal, stress issues, gut problems, hormone imbalances. We know your thyroid's involved. We talk about everything, blood sugar, everything that you have makes you have the complaints that you're dealing with. Your web of dysfunction is why you're suffering. And we have to talk about what is causing that and how we can address and improve it. Now, every single one of you has brain problems. I'm going to tell you why in a second. Every single one of you has nerve problems. You're all here because you think you have thyroid problems, so you have thyroid problems. You most likely all have gastrointestinal or gut problems. Even if you have no symptoms with your bowels, no problems with reflux, no problems that you think you have, I'm telling you, if you have a thyroid problem, you have gut problems. You have short-term memory problems, metabolic problems, all of that is involved. And they don't make a pill for that kind of problem. And the key thing is, no matter what they try to give you, they're not going to fix your web of dysfunction. So what we're all going to do is we're going to write our own webs down on our paper. Before I kind of get into that, I told you guys that you were dealing with the brain problem. Some of you may be thinking, I think I'm pretty good. I think my brain's healthy. I want you guys to go to that page 4, the one that I asked you guys to all fill out. We're going to talk about 4 parts of your brain. First thing we're going to talk about is a part of our brain called the frontal lobe. The frontal lobe is where all of your personality exists. It's what we call our executive centers, what makes you you. If you've noticed changes that lead to depression, anxiety, irritability, maybe a different personality, the frontal lobe in your brain is where that's happening. We're going to talk about an area called the hippocampus. Big word, but what happens is all your memory is stored here. If you have brain problems, if you have memory problems, you have a problem in the hippocampus. Number 3 is the parietal lobe. How many of you have pain of some kind? Could be an ache, a stiffness, a headache, sure. Sensation comes out of our brain. All sensory input goes to the parietal lobe, which is along the lateral side of our brain, And it's where everything fires into. And if it short circuits, we're going to hurt. We're going to have pain or numbness or tingling. That's why patients that come in to see me say, you know what, I woke up and my knee hurts. Well, what did you do last night? I went to bed. You didn't hurt your knee. You have a brain problem, and your body is breaking down and causing some random spot of your body to feel that pain because it's trying to tell you there's something that's wrong. The last area that I want to talk about is called the cerebellum. The cerebellum is in the back of our brain, and it's where everything coordinates into. All the signals from our feet, our hands, our thyroid, our lungs, our stomach, everything goes up to the cerebellum. It crosses and then goes up to the higher brain centers. And it's also responsible for balance and vertigo and equilibrium and proprioception and everything that we do that keeps us upright moving around. And it's something that gets impacted a lot when our body doesn't work right. So when we talk about your brain, goodness, they don't have any pills to fix the parietal lobe. They've tried. I treat a lot of neuropathy in this office, and a lot of those patients come in. It's where your feet are on fire, but if you look at your feet, they're not burning. Again, it's that parietal lobe that makes you feel like they're on fire. And they've got drugs like gabapentin or Lyrica or Cymbalta. They don't work. They dumb down your sensation, but they don't fix the problem. If someone has short-term memory loss, many of you, how many pills are there that are going to fix it? None. So when we talk about your brain, if you look at that page 4, all those yeses and nos, if you mark more than 5 yeses on that form, you have a brain-based problem. We know your brain is not functioning as it should. And what the brain does is it sends an electrical signal down your spinal cord that goes everywhere. And if the brain is malfunctioning, it can affect your thyroid, it can affect your immune system, your gut, your hands and feet. Everywhere gets impacted by it. And again, that metabolic web of dysfunction we talked about is going to tell us what parts of your body, what organs are malfunctioning. Before I get into your web, and we're going to explain and we're going to draw our own webs out, I want to talk with you just a little bit about thyroid. And again, if I'm going to improve your health, you have to understand how you got there. So some of you were diagnosed with a thyroid problem. I want you all to write this. Just kidding. I'm not going to make you write this down. But what I want to do is I want to break down basic physiology. Because again, what I know is people are told you have a hypothyroidism, you have a low-firing thyroid, take this medication, and that's all you're told. The reality is everything starts in the brain. We've talked about the brain a good bit. A part of your brain called the hypothalamus sends a signal to the pituitary gland. That hormone tells the pituitary gland to make something you've all heard of, TSH. Thyroid-stimulating hormone, or TSH, is a signal that goes to the thyroid to tell your thyroid to make hormone. Keep in mind, the TSH that you probably all had tested is not a thyroid test. It's a pituitary test. It's made by the pituitary gland. And that's important because there are people who have a low TSH but too much thyroid. There are people who have a high TSH but too little thyroid. And typically, you see it and associates a certain way, but because it's a pituitary problem, for certain patients, you don't look at that test only and tell you what's wrong with your thyroid. You have to look at the whole picture. Now, in a normal functioning person, TSH is going to tell the thyroid gland to make 2 hormones, T4 and T3. And if any of you are on Synthroid or Levoxyl, that's a T4. It's synthetic, and it's the most common form of the hormone that our body makes. 93% of what the thyroid makes is T4. 7% is T3. What happens is the body makes those 2 hormones, and then it has to hitch a ride. It hops on a little taxi cab, and it goes out of the thyroid. And it has to go elsewhere, and then T4 has to convert into T3. Because T4 doesn't get used by the body at all. It's not the active hormone. T3 is the active thyroid hormone. So what happens is if you have all this T4 that you're taking from a pill, it's not getting used by the body. What's happening is the body has to then take it and convert it. And that happens not in the thyroid. So again, whatever's going on with your thyroid is production issue. What's going on with your thyroid as far as function actually occurs in places like 60% in the liver, 20% in the gut, 20% in areas like the adrenals and the testes and the ovaries, the pancreas, and all these other tissues. Once T4 converts to T3, then the bodies use it and you feel happy. So what we know is you've had TSH tested. You may have had T4 tested, and we'll talk about testing at the end, but we have to know what your pituitary gland is doing. we have to know what your thyroid is doing. Is it producing the right amount of T4 and T3? We have to know, is T4 converting to T3? And we have to know, is your body using T3? All those different things have to be looked at, and all your doctors are doing is looking at 2 of the 5 things when they run labs on you. So literally, they have no idea what's wrong with your thyroid. They're just guessing and hoping that you feel better. And for some people, they do. For a lot of people, you end up in places like me, like my office, because you don't. The reason why you don't is that web of dysfunction, and we're going to draw ours out. I want you guys to go to page 2 for me. Now, I'm going to draw my web on my whiteboard here, and I'm going to have you guys follow along with each of these sections. We're going to start with category 1. How many of you went to doctors for your thyroid condition, and they looked at your brain and your colon to see if it was causing it? Probably not. So category 1 is your is your colon. Okay, category 1 is your colon. And if you have any 1s, 2s, or 3s in your colon, then it's contributing to your symptoms. It could be causing your thyroid problems. Categories 2 and 3 are your stomach. Anybody here have acid reflux type issues? So most people who have a reflux problem are labeled as acid reflux, but the most common form of reflux is actually not acid-based. It's a condition called hypochlorhydria. What it actually means is low acid production. As we get older, we don't make enough. What happens is we put food in our body. That food has to get brought down or broke down by our stomach, and when we don't have the acid, it can't. So what you're refluxing is literally the food that your stomach can't digest. And we end up seeing all sorts of problems develop with that. In fact, if we talk about 20% of our thyroid hormone converts in the gut. So this is a huge area. If we have problems with stomach acid, then we're going to see, you know what, your thyroid's not going to convert properly. Your calcium isn't going to be absorbed. So you know what, that's why you have all these bone loss issues. You're going to see problems with infections getting into you. I mean, a lot of things break down the stomach. Acid is really, really important to have in the right levels. Category 4 is our small intestine. So the way these forms work, if you have any 1s, 2s, or 3s in category 4, then you have a problem with your small intestine. 90% of your food is digested in the small intestine. 90%. So if it's malfunctioning, there's no way that you can break down your food and turn it into energy to heal properly. That's a huge, huge problem. And if we talk about that 20% in your thyroid, the gut is a huge part of that. Now, has anybody here had their gallbladder removed? No? Gallbladder removed. Okay. So, category 5, I want you to look at category 5, and if you filled it out, tell me if you have any 1s, 2s, or 3s in that category. And what I see a lot of times is people who have their gallbladder removed will fill the section out, and they still have symptoms showing up in category 5. And it's kind of, how does that happen? Well, category 5 is our liver and our gallbladder. It's very important for thyroid function. In fact, I mean, we talk about conversion of T4 to T3. 60% of that conversion occurs in the liver and the gallbladder. Those people who have the gallbladder out, if you still have symptoms, you kind of think, well, they can remove something, and you still have symptoms. But that's the genius of medicine. I mean, gosh, back when I had a musculoskeletal practice, when Johnny started with me years ago, we see 50% of all back surgeries are failures. I mean, I met a doc. He's a huge spine surgeon in North Carolina, a good friend of mine still. And I mean, when I first met him, he was excited about how much success they had with back surgery. 38%. And if anybody can be excited about a 62% fail rate, wow, what's that say about the rest of the profession? So this kind of gets me on a little tangent, but I want to cover this, because we talk about what your doctors are doing with you. We talk about how you're being treated. We talk about, again, people who have symptoms of a problem that supposedly was treated effectively. I really genuinely believe that the only good thing about insurance is it keeps incompetent doctors in business. Again, you don't go to your doctor because he's good. He's not good. You're still suffering. You're going to him because your insurance plan covers him. And you have to think about that when it comes to the health that you're dealing with. There's only one thing that matters. I want you all to write this down on page 1 at the very top in very big letters. And I need you guys to write this down. Results. That's all that matters. And none of you are getting the results that you deserve. we're going to look at categories 1 through 5, just a little more. We talk about all those categories, and there's two categories for the stomach. We call all those categories one thing. We call it the gut, the gastrointestinal tract. And something that's interesting is our immune system. 70 to 80% of it is in the gut, the vast majority of it. So if we have a problem with our gut, it's going to impact everything else. And actually, it's interesting. There's a huge connection between the gut and the brain, between the gut and the thyroid. We've talked about that. Even the father of medicine, Hippocrates, he said, look to the gut, you'll find the cause of almost all human illness. Now, if you have an immune battle in your gut, so your immune system says, you know what, something's wrong, it's going to trigger inflammation. That inflammation can impact your thyroid gland, it can impact your joints, it can impact several other areas in your body. And what we're talking about are things like infections, bacterial infections, parasites, mold, fungus, yeast, viruses, Epstein-Barr. You talk about the mono. Again, there's a link with Epstein-Barr and the development of MS in patients. We talk about an autoimmune disease, multiple sclerosis. An undergrowth of good bacteria, we call that a dysbiosis. So your bacteria in your gut, we've heard of probiotics. That's to give us good bacteria. Bacteria in our gut is responsible for not only healthy immune function, it's also responsible for a third of our daily energy needs. So if we have fatigue, do we have enough bacteria? That's a huge thing to look at. And how about food sensitivities? So I'm sure you've all heard of gluten sensitivity. It's kind of hard not to hear about it in our country right now. And the reason it's so prevalent is because so many people are getting diagnosed with it. And the reason they're getting diagnosed with it, quite simply, lays in large part to the issues associated with genetic modification. We talk about how what we eat today is not what we ate 30, 40, 50 years ago. There's a huge difference with that. I can tell you, I've got some bad news for all of you. I have 14 medical studies on my desk going from as small as 80 patients to as large as 10,000 patients in China. They did an Italian study. They did a study in Minnesota. They did a study in Turkey. Huge, giant studies that correlated a condition called Hashimoto's, which is an autoimmune thyroid problem, with gluten sensitivity. 100% correlation. If you have Hashimoto's, you have a gluten problem. And the reason we know this is because every single one of these studies tested for Hashimoto's, took those patients, and removed gluten out of their diets. And you know what happened? The antibodies, the attack on their thyroid, went down every single time. It's a huge, huge connection. So that's basically a freebie. If you guys have Hashimoto's, get off gluten, and your thyroid's going to get a little better. But I've got a bigger one for you. In 1998, the Journal of Metabolic and Endocrine Disorders, which is the #1 thyroid journal in the world, said that 90% of hypothyroidism is a result of autoimmune problems. So 90% of hypothyroid patients have Hashimoto's. What I just did is I took Hashimoto's, and we now say, hey, it's not just Hashimoto's that we have to worry about, because almost everybody who has hypothyroidism has Hashimoto's. Which means that if you have a thyroid problem and it's low thyroid function, most likely you have a problem with gluten. Get a quick sip of water.
Does that hurt more on the right or the left?
Yep.
I gotcha.
As we talk about your web of dysfunction, and we've talked about the gut being a huge, huge part of it. Category 6 and 7, any 1s, 2s, or 3s in category 6 and 7, this is blood sugar. So, optimal functioning blood sugar is 85 to 99. If you've had your glucose levels checked, 100 is not optimal. That's too high. 101 is too high. 127 is diabetic. But 100 is pre-diabetic. And we don't want to be pre-diabetic, because what happens is if our blood sugar goes too high, or if it goes too low, then it starts killing our nerves. And those nerves can be in our feet, our hands, our spine, or they can go to our organs. If I'm going to fix your life, if we're going to reinvent your life, if we're going to get you better, I have to fix your blood sugar. It's a huge, huge area. Patients, you may probably have friends who have dealt with infertility. The #1 cause of infertility is polycystic ovarian syndrome. We now know, and again, medical doctors are prescribing diabetic medications for this, because PCOS is an insulin-resistant problem. It's a blood sugar problem. So when we have issues with infertility, blood sugar is where we look. When we talk about an immune thing, we look at anything with the immune system, we look at blood sugar. Again, so many things impact it. And what we're seeing here is if any 1s, 2s, or 3s in category 6 and 7, there's not just one thing wrong with you. It's not just your thyroid. We're seeing a whole system going on with your health. Our brain, by the way, needs 2 things to function: sugar and oxygen. When we talk about a properly regulated fuel source gives good brain function, poor blood sugar leads to poor brain function. And if we talk about that brain, that's big because, again, that connects to the gut, that connects to your thyroid, that connects to everything. Now, categories 8 and 9. This is your adrenals. Now, the adrenal gland sits on top of our kidneys, and it is our stress gland. It releases cortisol. Now, cortisol is a hormone that we all see on TV that talks about the weight around our belly. But what it really does is it's our response to stress. And if cortisol goes up, you know what it does? Is it kills brain cells. It directly impacts the hippocampus and leads to short-term memory loss. So if we have memory problems, we have to look at your adrenals as a possible cause of that. Now, there's a direct correlation between categories 8 and 9 in that neurological assessment form because of that damage. But the adrenals also release epinephrine and norepinephrine. These are actually 2, kind of our adrenaline, if you will. But they're neurotransmitters, and they stimulate pain fibers abnormally. So if they get released, then they can cause pain. And we can see people who have pain because of the stress that they're under. We're all at risk for adrenal fatigue. And again, whether it's the mother of 4 or the retired couple, I mean, we all have a risk of our adrenals not functioning right. And something that's really interesting is a lot of patients that I see who have hormonal issues, menopausal or maybe andropause, libido issues, hot flashes, depending on male or female. Then they also have cortisol problems, and what happens is the body tries to shift hormones. So it's going to steal estrogen to try to make more cortisol. But the result for a lot of people is it ends up just taking this and dumping it down the hole, and you never end up getting anything fixed. You just get worse and worse and worse. Categories 10 and 11 are our thyroid. Category 10 is low thyroid function. Category 11 is hyperthyroid. And what's interesting is there can be people who have 1s, 2s, and 3s in both categories 10 and 11. If we have a bad thyroid, we have a bad brain. Bad brain, our thyroid's involved. What's interesting is I've talked about a lot of things that seem to impact, the thyroid impacts so many different things. But there's something called thyroid crosstalk. And you talk about your immune system has an impact on the thyroid, a tremendous impact. Your gut can impact your thyroid. The brain can affect the thyroid. Other hormones have a tremendous impact on your thyroid. Each affects the other. And if we talk about those other hormones, I want to talk for 1 second about something called the HP axis. It stands for hypothalamus pituitary. But what it basically means is it's the part of your body that controls your thyroid, your adrenals, your cortisol levels, and your male and female hormones. Now, who here has sleep problems? Anybody have sleep problems? So, sleep problems? So if you have trouble sleeping,
hearing problems.
Good. If you have trouble sleeping, cortisol sets your sleep cycle. It's something we have to look at, and it should be highest in the morning, lowest at night. And if it's abnormal, what's going to happen is your HP axis is going to then affect your female hormones, your male hormones, and your thyroid, and nothing's going to regulate because a problem with one is going to lead to a problem with the other. How many of you were told your lab tests were normal? So, again, the doctor goes in, you go into the doctor and they say, hey, you know what? I'm not going to do anything today. I'm just going to check you in 6 months because nothing's bad enough. We've all heard that. We've all been there, and it's really, really common. And what happens is we feel lousy and nothing gets done because they're just regular. They're not seeing anything that's so bad that they're going to say, aha, I have a cure for it today. The reason for that is quite simply most doctors don't run the right tests. They don't do a thorough enough job. We talk about TSH. We talk about your thyroid panel that should be run every time. And they're not using traditional lab ranges. Excuse me, they are using traditional lab ranges. And I use the same labs. I use Quest, LabCorp, Solstice. These are national labs, and I get a reference range that comes back. When that range comes back, it has nothing to do with optimal or healthy people. If you think about who gets blood work done on a monthly basis, if you go every month to get blood work done, are you healthy? No, you're sick. And it's statistics. So all those statistics are going into that range, that bell curve. And it's based on an unhealthy population. So what happens is, if you're outside of that range, there's definitely something wrong with you. You're lab high, you're lab low, there's an abnormality. But just because you're within the lab range, congratulations, you're as healthy as everybody who's sick. It just doesn't mean anything. It doesn't tell us what's wrong with you. In functional medicine, we use functional lab values. They've actually been established in the medical literature, and they're more sensitive. They help us reveal problems before they're so bad that there's no other choice for you to do anything about it. What we're talking about is, you want to be here in that healthy range, and they just want you to not be here. There's this huge in-between area where you feel lousy, but nothing's done about it. I want to give you guys two examples. TSH is the biggest example I want to give you guys, okay? For those of you who know your TSH value, the functional range where TSH should be is 1.8 to 3.0. Every time that's where it should be. If you're not there, then you have a problem with your thyroid. If you're at 4.2, your doctor is going to say you're borderline. Maybe a little high, but it's not bad enough to do anything about it. And that's hypothyroid. If you're 0.8, same thing. You know what? It's not low enough. They're going to say, it's awesome, it's perfect where I want you. But you know what? You have an abnormality. It's too low. Now, what's interesting is in 2003, the Endocrine Society, huge group, clinical endocrinologists, 8,000 of them around the country, established a new range for TSH. 0.14 to 3.18. Now, that range is consistent with the functional range on the high end, and of course, they say you can go much lower. And that's, because they're not looking for optimal, they're just looking for you not to have a heart attack, okay? But the problem with that is that range is a step in the right direction. It's a narrower range. And that was 9 years ago. But yet, what are labs still using? The high end is, 5, 4.5, 5.7. I mean, you see these labs, they ignore the endocrine doctor's own research, their own recommendation. And the problem then becomes your endocrinologist. They didn't read that article from 2003. So what are they doing? They're using what the labs give them. And they're saying 4.5 is perfect, even though their own group knows it's not. Does that make sense? If you don't look at your lab tests and look at them through the right perspective, you don't look at them through those functional values, you're going to miss problems. You're not going to get better. For those of you who've been tested, you probably had TSH done, thyroid stimulating hormone. You probably had total T4 done. There's a true thyroid functional test. I run this every single time on every patient. There's 7 tests that I run every time. TSH, total and free T4, which is how much T4 is being produced and how much your body can use, and it can be affected by medications. And that's what, again, if you're on Synthroid, that's the level they're checking. Total T3 and free T3. This is how much thyroid your body actually has to use. It's the converted form. It's the active form. And that's not affected by TSH. So if they don't check this value, if anybody goes on a drug called Armour, which is a great medication for some people, if they don't check T3, they have no idea what Armour's doing to your body at all, because it has T3 in it. You have to check these values if you're going to know what your body's doing. Free thyroxine index, that's how much T4 your body can use. Reverse T3, the body's really smart. It was designed to do a lot of things, or everything the right way. And it's like an overflow valve. If there's too much T3, the body's going to get rid of the extra. But the key thing is that value, which indicates that, can be abnormal if you're on HRT, if you're on hormone replacement, if you're on birth control, or if you're on those pellets from those doctors. Something that helps support your female hormones. So the key thing is that can impact your thyroid, and it can actually block T3. So that's important. Now, these last 3 tests are what really matter for you guys. TPO and TBG antibodies indicate a condition called Hashimoto's, which I said 90% of you probably have. And TSH antibodies indicate Graves' disease. So if you have thyroid antibodies, then you have an autoimmune problem. And the key thing is, we're talking about these normal ranges. You got to run the right tests, and you got to look at them the right way. The reality is,
could you possibly go back and tell us those tests again?
Yeah.
So I could write those down?
So just, and my staff can actually give that to you. And we have that, you have that in one of the reports that you'll get from my staff if you haven't gotten it already. So yeah, you'll get that. Absolutely. If you guys want normal, you're in the wrong place. I don't want you to be normal. You want normal, go to Walmart. Set a lawn chair out and watch what goes in and out. We are a sick society. And those lab values establish that normal range. I want you to be healthy. That's completely different. We don't want you to suffer. I want you to get your life and enjoy it. And if we talk about lab ranges, if we talk about the tests that are done, you have to run the right tests if you're going to find out what's wrong with you. Now, if we talk about those thyroid antibodies one last time, Hashimoto's and Graves' disease, they're autoimmune thyroid problems. But they're not thyroid problems. They're actually immune problems. Your immune system is attacking your thyroid gland. What happens is something is causing your immune system. There's an imbalance that's causing your immune system to attack your thyroid gland, and you have to address what that imbalance is. Your web of dysfunction that we're going through tells us a lot of where that imbalance is coming from. The last categories on here, categories 14 through 17, are your sex hormones. What we're talking about, 14 and 15, are male hormones, andropause, prostate issues, libido problems. Categories 16 and 17 are female hormones. Any 1s, 2s, or 3s in these categories, and you have a problem with your hormones. With female hormones, we're talking about category 16 is infertility, menstrual cycle imbalance, cycling women. Category 17 is menopausal women. How many people I see that come in my office who have been postmenopausal for 8 years, for 20 years, and still suffer from hot flashes? And again, we talk about these are issues that they shouldn't be dealing with, and there's an imbalance that's never been corrected. And again, the main reason I talk about blood sugar, I talk about adrenal involvement, the thyroid, your brain, all these things impact and can affect your hormones and create that breakdown, which then leads to your web of physiological dysfunction. If we talk about why you're suffering, it's my job to figure out this. And there's a lot on here. It's very daunting. And again, even what we've talked about, when you fill out those forms, if you haven't done it all already, when you fill out those forms and look at your 1s, 2s, and 3s, you're going to say, hey, there's a lot of different things I've seen here. How do I figure it out? There's an order to all this chaos, and I call them health breakers. I have to fix these problems if I'm going to get you better. If these problems don't get fixed, then you're going to still suffer, and we have to get them taken care of. First and foremost, the number one thing in the world for you guys, if you have a thyroid problem, do you have an autoimmune disorder? That's the first thing we have to identify. If you have an autoimmune disorder, then everything has to be based on how we can get your immune system to balance out. And I'm not talking about prednisone. I'm not talking about suppressing your immune system. That's the medical way. That's the only thing that can be done. I have a patient that gets injections. It's called IVIG. He gets IgG injections to help give him pain relief from his neuropathy every month. And each injection costs $12,000.
Oh.
The reason he has that pain is because of what we're talking about. And literally, in weeks, we've seen his symptoms decrease by over 50%. And it's about finding where it's coming from, not just saying, here's something that can cover up and mask the symptoms, especially at $12,000 a pop. Blood sugar, the number one stressor in your body. It can cause thyroid problems, heart problems. Anemia, and I'm not talking iron, B6, B12, pernicious anemia. Inflammation, this is huge. Again, we talk about your joints hurting. We talk about your brain fog. We talk about bone health, cardiovascular health. Inflammation, homocysteine and C-reactive protein is like a blowtorch going off in your body. And we have to turn that blowtorch off. Gut function. We know 80% of your immune system is in the gut. If none of you have GI symptoms, you still have a gut problem because your immune system is in your gut, and you have a thyroid problem, which is most likely driven by your immune system. So we have to look and see, do we have food sensitivities? Do we have infections? Do we have leaky gut syndrome? We address all these through proper testing. What's going on with your thyroid? Are you producing enough TSH? Are you making the right amount of hormone? Is your body converting the hormone? Is it using the hormone? And do you have that autoimmune reaction against it? And we've got to look at your lipids, fatty acids. That's important because everything functions. It's actually interesting. I've seen patients who are on statin drugs, and or even, their cholesterol is like 120. It's so low. And the doctor said, I've never seen cholesterol that healthy. And yet the patient complains of no sex drive. And they say, you know what, I hurt and my hormones aren't right. And the doctor is too incompetent to realize the connection between cholesterol producing your sex hormones. So he'd rather keep you on a statin drug to keep your cholesterol below the 202 that it started at, and yet you suffer needlessly because he doesn't understand how your body works properly. You got to look at the whole body. You got to look at the interaction between the different parts of the body if we're going to get you better.
I just got a report back on my blood work a week ago. My cholesterol was 122. And he has had me on Niaspan and Lipitor. I quit taking Niaspan. I said, why can't I quit taking these? It's always down, but that's to keep it down.
That's too low. It's to keep you down, Johnny.
Yeah.
I mean, it's to keep you down. It's to keep the man down in your case, keep you down. And again, this isn't doing you any good, and we'll talk about that. Because like I said, optimal cholesterol is 150 to 199. And actually, there's a foundation, the Weston Price Foundation, which is a nonprofit research. They say the optimal level for total cholesterol is 227. And again, if you talk about the research that's out there, it supports those numbers. You talk about, I mean, again, we talk about some of your health issues. That's really low. That really is. And again, you're taking something artificial that suppresses that. That's no good. So how do I help you? You know, we talk about your web. I got to find out what's driving it. What's pushing your dysfunction? What's making your body attack itself? What's making these different systems not work right? Fix your blood sugar. Fix your adrenals, your hormones, your stomach issues. Get your body in balance. And then your immune system is attacking your body most likely. So we have to calm it down. We have to get it to stop attacking. And we use tools like vitamin D, glutathione, and fish oil, and curcumin. Talk about turmeric. Hey, it's a great spice. You wonder why, you know, Middle Asians live to be 100 and they're super healthy. Well, they eat good. And that food goes a long way towards reducing inflammation in our body. And sure, there's health issues, but it's not the same kind of things that we have here. And for those of you that are on supplements, be careful. Now, I use supplements to treat, okay? But you have to use them to support the body the right way. And when you use them to support the body, you do not want them to drive an immune problem. I have patients that come in with a bag of supplements. And you know, they're on 20 things, okay? Half those supplements are making your immune system attack your thyroid, and a third of them are trying to counteract that, and the rest are maybe doing good or doing nothing.
Wow.
But there's so much that goes into making sure that you're taking what your body needs and not making yourself worse. In my office, as a chiropractic neurologist, I use therapies to drive the brain. We improve brain function. We use everything from eye therapy, vision therapy with sunglasses that have LED lights in them that stimulate the different lobes of the brain we talked about. We use sound therapy with the interactive metronome, oxygen treatments in my office, vibration, tools that get your body to turn on so your thyroid can work the right way. For some patients, that's a key part of their care. For some patients, it's something that they can do a lot of the work at home as well. But you have to address the whole body if we're going to help you. And again, it all starts with proper testing. So, if I'm going to help you guys, again, life is a matter of choices. Again, I appreciate you spending the last hour with me. My goal tonight was to reinvent your life. Hopefully I've done that. But you have to keep in mind, all the knowledge that I've given you over the last 45 minutes doesn't do you anything unless you take action. Knowledge plus action is how you get results. I want you guys to ask yourself 2 key questions. If you want to do something about your health, if you decide to take the next step and make an appointment with my office, what can improve in your health if you schedule that appointment? And more importantly, I want you to ask yourself, what will happen if you decide not to do this? If you decide to say, thank you for the information, it was great, but I'm going to live with my web of dysfunction and not fix the things that we've talked about tonight, where do you see yourself in 3 or 5 years?
Wow.
If you like what you heard, I can obviously sit up here all night and teach you guys more. But most importantly, you guys have to do one thing. In order for me to help you, in order for me to reinvent your life, you have to make an appointment. It's really that simple. Now, what I do in my office, we have a 2-visit new patient procedure. Those 2 visits are going to be close to 2.5 hours of my time. If you've had labs that have been done by other doctors, I will get them. I have had patients give me literally binders. They've been suffering with this condition for years, and they've cataloged what they've gone through. And I will review everything prior to us meeting, because I want to know your history so we can maximize the time that I spend with you. You're going to come in and we're going to do a full neurological examination. We're going to look at how your brain is functioning. We talked about how it involves and impacts your thyroid. We're going to look at those nerves and see if they're working right or if they're damaged. Do you have the sensation that you once did? Are those receptors getting damaged because of inflammation? and we're going to do a case review and really talk about your struggles, your challenges, and what we can do to help you. I don't require your spouse to be here for the exam. I do recommend it because we're going to do a lot of testing. We're going to really look at your brain and how your body functions, but I do want your spouse here for the reported findings. They have to know what we found wrong with you, and they have to know how we're going to fix it. My normal 2-visit process is a $450 process. Because you guys have come here to this workshop, I discount that down to a reservation fee of $60 if you pay tonight.
I have a question.